discuss more on the health impact of pollution, we are joined by Dr. Sandeep Nayar, Principal Director and Head Respiratory Department of BLK-MAX Super Specialty Hospital in Delhi. Thank you, Mr. Nair, for joining us on Mirror on this discussion. A very important discussion, of course. Situation is dire in Delhi. People breathing toxic air. People of Delhi, in fact, grappling with respiratory and other health issues. You know, what is the kind of increase in admissions and hospitalizations that you've been seeing over the past few weeks? And what is the short-term and long-term health impact that you've been seeing of being constantly being exposed to pollutants?
See, the number of patients have increased. It's not only the number, the severity with which the patients are coming to us has also increased. So around 20 to 30% rise in our OPD patient with the respiratory problem because of pollution has been seen now. And unfortunately, many of the patients had to be admitted because they were so in a respiratory distress. Of course, there were patients who were having problem of respiratory since from few years, but they were well controlled on the medication. But past few days, they're experiencing a worsening of the problems. And even new patients who never had any problem, or even you and me when walking outside, we are feeling something burning in our throat, in our eyes, watering of eyes, headache. So these are prevalent in a lot of our patients. And you're right. It is basically once the impure air enters our body through our nose, is no longer confined to our respiratory system only, because the smaller particulate matters like PM2.5 and the noxious gases, they get diffused into the blood, and from blood it goes to each and every part of the body. So of course there will be some short-term and some long-term effects. Short-term will be there will be headache. There'll be blurring of the vision because you can't see anything when it is so bad air outside. You will have cough, which will not go with the normal medication. You will have respiratory problem. You will have wheezing. You will have breathlessness. So these will be there. And then there are some long-term effects also, because once it is diffused into our body, it goes and affects each and every part. So you will have heart problem. You have lung problem. You can even have the pancreatic problems or the GI tract infections, and very long-term and very high exposure to it can even lead to a cancer, as we know it in our past experiences. And even the pregnant females who are carrying the small babies who have not even seen the light of the day, and when they are getting exposed to the polluted air through their mothers, they also can even lead to low birth weight and even premature birth. All these things will be there if in case we are continuously exposed to this gas chamber.
Right, Mr. Nair, you're saying there are going to be a short-term as well as a long-term health impacts as a result of this exposure. Now, according to you, how can people keep healthy and safe under these conditions? Because many measures are being implemented, be it odd even, firecracker ban, restriction. How much of an impact will these measures have on our health?
So my request to each and every one of us that you try to remain inside as much as possible. Of course, one has to go and do work, then they have to go out. But otherwise, unnecessarily going out, unnecessarily going in their vehicles and, creating more pollution, is better you go for carpooling if you ever have to go out, or use a government transportation system, metro or CNG-aided buses. But please try to remain as much as possible inside. But in case you have to go out, please cover your face, wear a mask, and take a good healthy diet. That's very important, because many times in the winter season, we tend not to drink much or eat much. So please keep yourself hydrated. Take enough of water. And those people or those patients who have already got some problem, for a cardiac problem or a heart or a kidney problem or a lungs problem, please continue to take their medication. And that's what I request my respiratory patient, that please continue taking your inhalers or whatever medication you are taking, despite if you're feeling better, because many of the medication are prophylactic. They are helping you to tide away all the crises. So please don't, stop the medication, even if you're feeling better, until unless your physician tells you to do so. So, in smallest problem, please contact your doctor, because there's a time when we have to take the medicine at an appropriate time. Will definitely help you better.
Right. Mr. Nair, of course, you're giving a lot of tips as far as, what citizens should be doing is concerned. But, Mr. Nair, what's the long-term solution? Because there are a lot of measures that have been implemented by government. Are you satisfied by the measures that are being implemented? Do you think government should perhaps pull in doctors, medical practitioners to perhaps implement, more measures, more concrete measures? So what, according to you, can be a long-term solution to ensure that people's health, is not impacted as much?
See, Radhika, if you agree with me that this is not the first time which has happened. Every year, this part of the time, it starts with this problem, and then we are all sitting in and debating on the same problem every year. So there has to be something. Why it is happening every year? Why can't you stop it? It's not a once-off some problem which has occurred and we were just taken by a surprise and we have to take care of it. It is happening every year, but still nothing has been taken concrete. I think we should all sit together. And like I said, charity begins at home. Each and one of us should start right from our home, try our best that we contribute minimum to the pollution and maximum to clean air. And of course, we should. The government should take us. You're right. They should take everyone who can help us, help the public out. Maybe a doctor, maybe the pollution expert, or the MCDs, or everyone who is responsible for the benefit of the patients or the people in fact, general public as such. And we should all sit together and see what is to be done, because this long-term effect when is going to occur to us, and what is we are leaving for our next generation. Is this the air we want our children to get into it? We don't want our children to grow in this gas chamber. I think we should all sit together, take some concrete steps. It's time to take some concrete steps. Nothing to be sitting on a chair and saying this will be implemented. This should be implemented, not will be. And we should be very firm on whoever is going against a law or whoever is contributing to the pollution.
All right. Thank you, Mr. Nair, for joining us with all your thoughts.